Hello, my name is Heather Bridgeford. I'm a nurse practitioner here at Urology San Antonio, and I'm going to talk to you a little bit today about interstitial cystitis, otherwise known as IC. This is a very complex diagnosis. Usually it's supposed to be a diagnosis of exclusion. What that means is that the provider that you're seeing has ruled out any other cause to your symptoms. And so that's what diagnosis of exclusion means. Typical symptoms with interstitial cystitis, the hallmark is going to be bladder pain. So that's usually presents like lower abdominal pain or pain with urination. Can also have you can also have a lot of urinary urgency and frequency that go along with that pain. Most people describe it as feeling very similar to having a urinary tract infection. However, when they go into the provider and get their urine tested, there is no presence of bacteria to be causing their symptoms. So right now the goal, if somebody has symptoms of interstitial cystitis, the goal is really to rule out anything else that could be contributing or causing the symptoms that they're having. And then if we decide that somebody has a sensitive bladder like interstitial cystitis, then we can start to initiate some therapies that can help improve the way that they feel. There are many different types of therapies to help with somebody who has interstitial cystitis. A common flare or cause of a flare in the bladder, when I say flare, I mean worsening of symptoms, are different things in a person's diet that can irritate the bladder. That is pretty common. So dietary bladder irritants are very common for causing increases in bladder pain and urgency and frequency with interstitial cystitis. Those dietary irritants commonly are high in acid, so really acidic foods and drinks, anything bubbly, and anything artificial. So we're talking about artificial sweeteners or canned things that are artificial or preserved. But when I talk to a patient about dietary bladder irritants, I really tell them that they have to be their own detective to figure out what flares their bladder, because what flares one person's bladder is not necessarily going to make another person or patient feel bad. But the common ones are going to be coffee, tea, soda, orange juice, anything high in acid. Those are the common ones. The other thing that can really flare people's bladders or make their symptoms worse is stress. And being alive is stressful, okay? Everybody encounters different types of stressors, but what's stressful for one person may not be stressful for another person. So I tell patients they need to identify a stressor for them that worsens their symptoms, so maybe they can avoid that stressor or eliminate it to improve their symptoms. The testing that we typically do to rule out other causes or contributing factors to your symptoms before we decide that you have interstitial cystitis is going to be a picture of your kidneys, so either a kidney ultrasound or a CAT scan of your kidneys or a CT scan to make sure that there's nothing going on up there. And then oftentimes the physicians or nurse practitioners or physician assistants will decide that a patient needs to look inside of the bladder. That procedure is called a cystoscopy. There's some in-office treatments that we can try to improve your symptoms. Those are bladder installations where we put medication into your bladder to try to calm down your bladder. There are also medications we can use to try to calm down your bladder. We can try to calm down the frequency and urgency of urination, calm down the pain with urination. Beyond that, the treatments include maybe sending you to a pelvic floor physical therapist to see if we can calm down the pelvic floor, calm down the bladder. Sometimes the pelvic floor muscles are a lot of the sorts of the pain that's making the bladder angry. Beyond that, there is a procedure in the operating room where we can try to improve your symptoms there.